Why should promoting health for the future be a political priority now? And what role should the innovative pharmaceutical industry play in shaping that agenda?
So health should always be a political priority. As people, it's the most important thing that we have. If we look at the current trajectory as we have aging populations and a greater burden, particularly of non-communicable diseases, if we don't take action, then the average person will spend around 42 days ill per year from what are preventable illnesses. Now, this means that politically we need to be looking at health, not only in terms of the benefit it provides to people, but the early use of preventive measures like vaccines, early diagnosis and treatment as actually helping and preserving our healthcare systems, but also fostering economic growth for countries and also health security. Innovation is central to this, and it's estimated that there will be around between 300 and 500 new products launched by 2030. Many of these will be transformative in what they can offer. By the use of those interventions combined with screening and early detection, we can make a major impact that will benefit both patients, the economies, and, as I mentioned, health resilience. So for governments, this means there's an imperative to treat health as strategic and core to their strategic agendas.
Looking ahead, what are the key challenges and priorities for the pharmaceutical sector, especially in advancing equitable access to medicines and healthcare?
The main thing we focus on is to ensure that we have an environment that fosters innovation and that innovation can translate into the next generations of vaccines and medicines that will help people. In order to achieve that, it's essential that innovation, that healthcare, remains a priority for governments. We can't afford to let it drop down the political priority list, because ultimately society will lose significantly if that were to occur. We need to ensure that there is access as broadly as possible for those that need and will benefit from the interventions. And as part of this, IFPMA has looked at what we call the Innovation Development and Access Pathway, where we look at the barriers to access throughout the system. This includes what may be regulatory barriers, healthcare infrastructure and functioning, financing, and then for us to work as an industry in partnership with other stakeholders to try and unblock those critical areas to ensure that the interventions reach those that need them.
How can global leaders, alongside organisations such as the IFPMA, work more closely at forums such as the G7, G20 and the United Nations to strengthen health systems and expand access to innovation worldwide? It's
key to remember that vaccines and medicines will remain central to supporting healthy people, healthy systems, healthcare systems, and healthy economies. And as such, it's critical that at forums like the G7, in discussions at OECD and another critical forum when we're actually looking at the bigger picture, the economies of countries and how we function as a society, that healthcare and the pharmaceutical industry are both seen as being key and strategic to those discussions. And the recognition of the pharmaceutical sector as a strategic sector at the G7 level is critically important, particularly at this time when there are so many competing priorities, because ultimately health is one of the most valuable things we have.